Cholesterol is not of concern compared to this one thing. Hi, this is Dr. Murray from Murray Natural Integrated Health here in Hastings, Nebraska, doing a short video here for you today. And again, saying that cholesterol is not of concern compared to this one thing. And that one thing is inflammation. So many people during Heart Awareness Month think quite a lot about cholesterol. And that is a topic to bring up and discuss. But it's very much important to realize that compared to inflammation, it's not as big of a concern. We need to be concerned about inflammation. When people are out having cholesterol testing, looking at their totals and their HDL ratios, still good information to look at, but we have to understand that there's more that's going on in the body than just cholesterol. And the biggest problem with the majority of chronic degenerative conditions that we have in our body, from our brain, from inflammatory conditions going on our brain, from our heart to even joint pain, even intestinal issues and lung disorders, inflammation is the name of the game, and is more important to discuss that. More important, put more emphasis on inflammation than anything else. And that's why we can say cholesterol is not a concern compared to this one thing, which is inflammation. Conditions that are associated with heart disease. Well, weight and obesity. Around 95% of heart disease has an obesity connection. Around 25 to 30% of all diabetes of heart disease has a diabetes connection. Around 20 to 40% of heart disease has a smoking connection as well. And then also hypertension. A large percentage of heart disease has a hypertension connection, around 30 to 50%. And then also, if you look at cholesterol, if you look at the specific detailed amount of influence that cholesterol has on heart disease, it's only around 15%, around 15%. See, all those other things I discussed there, morbid obesity or obesity just in general, diabetes, smoking, hypertension, all of those have an inflammatory component that comes with them. And so they have a dramatic impact, not just on heart disease, but also on the entire body. Inflammation, if you look at brain related disorders, anything from Alzheimer's to Parkinson's to also senile dementia, there is an inflammatory component related to that. Heart disease, of course, there is an inflammatory component connected to that. A large amount of heart disease is related to inflammation. Pulmonary disorders, we talked about that as well. Joint pain, you're talking about inflammation. So before you can form a cholesterol plaquing in your artery, you have to have inflammation. And that's why it's important for us to focus on that. And all the things I mentioned, from obesity to diabetes and hypertension, smoking, those kinds of issues, those are modifiable factors. Those are modifiable risk factors that you and I have a control over. I don't know if you know this, but the Centers for Disease Control, they have stated before that there's around in excess of 300,000 people, their lives can be saved each year through prevention measures. Around 300,000 heart disease deaths are preventable through prevention each year. That's a very important number for us to talk about. And again, it has a lot to do with, more so, the things I just mentioned, inflammation and issues regarding inflammation, than just cholesterol. So what are those inflammatory factors, those things that you and I have really a lot of influence on? Well, of course, we mentioned smoking. I mean, that's kind of very obvious. Certain things are lifestyle we need to get rid of. Smoking would be one of them. If you're smoking, it's tough on your entire body, creates inflammation in your entire body, and nobody really disagrees with that. Alcohol, that does as well. Alcohol increases inflammation in the body. Nobody is deficient in alcohol. It's a toxin and it does have an influence on the body. Yeah, I understand people like it, but it's just a reality that we need to talk about. So alcohol. Other beverages and other dietary factors that we take in all the time, from soda to highly refined processed foods to just anything that kind of spikes your insulin. It increases in the inflammatory process in the body. You know, most cancers also are insulin growth factor positive, meaning that they respond very favorably and grow in the environment of high sugar. So inflammation just in general, these things I just mentioned, These are things that you and I can have an influence on. They're modifiable. The things you and I can do something with. I mentioned hypertension because hypertension pushes on the arteries and over a long period of time creates damage to the artery, thus creating an inflammatory process because majority of heart disease has an inflammatory component related to it. So how do you heal from inflammation? How do you reduce inflammation? Well, you try to cut out all the garbage that we just discussed there. Of course, you cut out your smoking, you cut out your alcohol consumption. You also cut out your high refined sugars and starches and carbs. Those highly refined diets are just not good for anybody. You keep your insulin status down. You keep also your weight down. All those are good things to do. And you also try to keep hypertension and your elevated blood pressure under control as well. Vitamins and nutrients. Nobody is deficient in Crestor or Lipitor. I'm not saying you shouldn't take that if you absolutely need it. I'm not saying that. But again, a good chunk of heart disease is what relates to inflammation and how you heal and repair. You need nutrients to help heal. And many people, they are deficient in multiple nutrients. This past week, people who are taking multiple medications, I asked them, have you been tested for your omega-3s? Have you been tested for your B12? Have you been tested for vitamin D? And everyone that I've asked this week said, outside of one person did have their vitamin D levels tested. Besides that one person, nobody else was tested for these things I mentioned. Even cardiologists are not testing your omega-3 fatty acids, and those are the American Heart Association says they understand that it's good for blood pressure. They understand it's good for reducing inflammation in the heart. But so many people are not being tested for these things. You're not deficient in cholesterol medication, but many people are deficient in omega-3 fatty acids. And the CDC recognizes that I think around 80% of the American population, they are getting insufficient amounts of omega-3s in their diet. Hormones and antioxidants. Some people, their hormone status is affecting how they heal from normal inflammation. We all have inflammation. You have inflammation. I have inflammation. You actually need some amount of inflammation. It's when that inflammation goes too far and we have too much destruction of tissue and not healing of tissue. And so if your hormone status is off, that will affect your ability to heal, right? So when you're younger, you tend to heal better than when you're older. And some of that has to do with your hormone status. So checking on your hormone status, yes, your thyroid, but perhaps checking on your sex hormone status is always a good thing to check as well. Antioxidants, and that gets back to foods, of course. The foods you take in have antioxidants that help to protect your body so it can heal and repair from normal inflammation and from the other crazy stuff we do from time to time that increases inflammation on a transient basis. So what can you do about these things? Well, first, you can change your diet. You can change your lifestyle. Those are obvious things you can do. You can also test for nutrients. You can see what your deficiencies are. You can see where you're lacking something because your body is designed to heal and repair and self-regulate. And if you're not giving your body what it needs, how can it heal from the normal amount of inflammation, let alone from inflammatory things that are going on in your body that have been left unchecked for quite some time? Maybe inflammation in your brain, maybe inflammation in your heart or your lungs or in your joints. Are you deficient in Tylenol or ibuprofen? Of course you aren't. But many of you may be actually deficient in a nutrient, and you can ask your physician to test it. They can test it, and not to test is to guess, to test is to know. Same thing with your hormones. Have you had your sex hormones tested? Or have you had a good thyroid test performed? Don't let somebody just tell you that, yep, we checked it, it's done, it's okay. You are the one that needs to be in control and check out and make sure this has been done, because we've had several patients who have come in and they said they tested my hormones, and you look and they tested like 1 out of 10 things. You don't want to have just kindergarten type tests done, especially if you're having problems. You want to have the right test, a thorough test to get to the root cause of the problem. And looking at your hormones, testing those is often a good thing to do. Many people from an inflammatory standpoint, they have low oxygen. This is an important issue. Many people do not understand that their lung volumes, that their pulmonary function is low. And if you're not getting oxygen into your body efficiently and effectively, then that will affect how you heal from normal amount of inflammation. But also for those that do have hypertension, have heart disease, have diabetes, have problems in any place in their body, have dementia, you need to have adequate amount of oxygen present. So making sure that your pulmonary function is good. And secondly, if you're getting enough oxygen at night, many people are not getting enough oxygen at night. And of course, you can test for that. You can look for that quite easily. First, you can do a sleep test, which is an easy thing to do, and you can do an at-home sleep test. You can also do an in-clinic sleep test as well. But secondly, you can also do an at-home O2 ring. So at night, you can have an O2 ring. You can purchase that online, and it'll tell you what your oxygen levels are doing at night on average. It's a great test to do. But if your oxygen levels are low, boy, you can't metabolize sugar properly. You can't regulate your blood pressure properly. You can't heal from scratches on your body properly. You can't have proper male function properly without proper oxygen. You can't think properly. It's important to have proper oxygen levels. And detoxification. Another one there, easy thing that you can do. You want to make sure you're getting plenty of water to drink. You want to make sure that you are eating properly and getting proper nutrition, but you can also detoxify. We can also do some testing that looks at your heavy metals. It looks at your heavy metals, whether it's coming out through the hair or the urine. But that's an important thing to realize, is that the things that we are exposed to also can affect us in detrimental ways as well. In Nebraska, we have high amounts of uranium. In the Hastings and surrounding area, there have been concerns about toxicity in our environment here as well, which has increased likelihoods of different cancers. So it is kind of a fallen world, and there are things that kind of affect our health from other standpoints that cause inflammation in our bodies. So cholesterol is not the greatest concern. It's not of a concern compared to this one thing, which is inflammation. We can help with inflammation. We can help in aggressively preventing conditions. So give our office a call at 402-463-4257. And in February, we do have a free heart health screening involving an EKG, ankle brachial index, and basic vitals. So make sure you take advantage of that every February here in our office. Murray Natural Integrated Health, setting the standard in natural healthcare. Have a blessed day.